Hi, I'm Anwiti Singh, and you're listening to Three Things, the Indian Express news show. In this episode, we talk about a recently concluded football tournament in Jharkhand, which was contested by 32 all-women teams from 23 villages and highlighted social issues plaguing women and children in the state. We also give an update on the case against serial killer Charlie Sobhraj. But first, we talk about the upsurge in COVID cases in China. In the last few weeks, China has reported a swift rise in COVID cases across the country, which could result in over 1 million deaths in the coming months. The COVID infection was already spreading from March or April this year. At that time, China was under a lockdown. And this lockdown was so strict that it angered the citizens, who then organized massive protests.
So in a country like China, those kind of public protests are quite rare. And we had seen there were a lot of triggers to those protests. One, of course, was, the opposition to the restrictions that started at an iPhone factory in China. Also, the World Cup had just started and people in China could see how the rest of the world was completely free of any kind of COVID restrictions and they were enjoying. And they suddenly started questioning their own policy, wherein very hard restrictions were still in place in China. And those were probably some of the triggers that led to those protests. And initially it started in only a few places, but very rapidly spread to a large number of towns and cities. It has died down now, but it did lead to a lot of pressure on the Chinese government. And the government has, in fact, withdrawn some of the restrictions that were in place for a very long time.
That was Indian Express's Amitabh Sinha, who joins us in this segment to talk about the present situation in China. He says this rise in COVID cases is not just because of the restrictions easing down. China had seen surges in March and April as well. And Amitabh says we need to look at how the country handled the pandemic in the last 3 years to understand the current situation.
To understand why that is happening, we have to understand a little bit about China's strategy towards COVID-19. From the very start, from around March of 2020, China took a very different approach to managing the pandemic. While the rest of the world was slowly learning to manage and contain the spread of the virus, China took a very extreme measure. It adopted a so-called zero COVID policy, wherein it resorted to very hard, very harsh measures, which involved hard lockdowns, which involved prolonged isolation. And this strategy was to not allow the virus to spread at all. So even a single new case or a couple of new cases in any locality or a small town, that would invariably lead to lockdowns of the entire town or at least a part of the town and compulsory isolation for everyone. Even every contact of an infected person would put into prolonged isolation. Every traveler, someone coming from outside the country, they would have to undergo mandatory isolation. So those kind of things, very, very harsh and restrictive measures. And these were painful for the people.
But these measures were not without success. Amitabh informs us that the case count and death counts in China were quite low because of these measures, even though it made people angry.
So if COVID had not persisted as long as it has, and no, it continues to, and we don't know till when the virus would continue to spread, if it had disappeared in the first 3 years, Chinese strategy would have been a very successful strategy, even though it had come at a lot of pain to its citizens. But China could have always claimed that it managed to avert a lot of deaths. The kind of deaths that we have seen in India, for example, or in the Western countries, in the United States, in Brazil.
So why is China's situation so bad right now? Amitabh explains that it is because of the zero COVID policy, which means the country took drastic measures to keep people in lockdown, long-term isolation and mandatorily hospitalized so that the virus will not get a chance to spread.
Its zero COVID policy ensured that a very large number of people, a very large proportion of people in China never got infected. And because they never got infected, they did not have natural immunity to the virus. And because they do not have a natural immunity to this virus, it means they are extremely susceptible to getting infected. Once the virus may manage to break through the defenses and sneak in, it gets a very large number of susceptible people to spread to.
And that's why the virus spreads very fast. The moment the virus breaks through the defenses, it can get to a large group of susceptible people and spread fast through them. But there is also a fear that the virus may mutate into a more dangerous variant. Amitabh says the chances of mutation increase with the number of people the virus infects.
If the virus spreads to a large number of people in China, there are chances that we will also see newer variants coming up, new mutations of this virus coming up pretty soon. Now, whether those new variants would be stronger or weaker, more dangerous or less dangerous, that's a matter of chance. Mutations you cannot predict. They happen completely in a random fashion, and it's all left to chance.
Even though people cannot predict whether the virus will mutate or not, Amitabh says the overall predictions for China are grim.
What is being predicted is that a very large number of people would get infected in very short periods of time. What that would mean is that hospitals might get overwhelmed, because even if very small proportion of people need hospital attention and medical care, because of the large numbers involved, we are talking about a group of 1.4 billion people, the load on hospitals might become very high. We really don't know what are the kind of interventions that the Chinese government is looking at, whether they are looking at going back to the very harsh measures that they have been adopting all the last 3 years, or they are more amenable to slowing down the spread and managing the pandemic like many other countries have learned to do over the last 3 years. We really don't know. And a lot will depend on the kind of interventions that the Chinese government would make to deal with the pandemic. And we have to realize that these are possibilities that people are talking about. These are not certainties that will definitely happen.
The predictions also warn that potentially millions will die in the country. A report published in Nature on Monday cited a study which said nearly 1 million people could die in China over the next few months. Reuters, on the other hand, listed 3 other recent studies which have projected between 1 to 2.1 million deaths in China. While such projections in the past have been way off the mark, China's situation does look dangerous because of a large population who were never exposed to the virus. But what about the vaccines? China was the first country which started vaccination programs. While vaccines around the world have not been very effective in preventing infections, they have managed to reduce the severity of the disease and prevent deaths to a large extent. So can vaccines help in preventing severe infections or even deaths in China? Amitabh says that it will be a challenge because the Chinese vaccines, Sinovac and Sinopharm, are not really effective.
One of these were developed as early as June of 2020, so basically just within a few months. And it had started administering these vaccines by, I think, June or July of 2020 is when they began, much ahead of any other country. But that also meant that these vaccines were not entirely mature at the time that they started to get administered. The critical thing is whether the Chinese vaccines would be able to prevent severe disease and deaths as other vaccines have been relatively successful at doing in other countries. Now, that would be the true test of the Chinese vaccines.
Now, the Chinese government will have to come up with strategies to combat this upsurge. But Amitabh says that the government needs to find a new way of handling this and cannot resort to the methods it subscribed to for the last 3 years.
It's not going to be the same as it was in the last 3 years for China. These 3 years were very, very different. They managed the pandemic in a very, very different way compared to the rest of the world. And now they will probably have to, resort to different methods. And the trajectory that the pandemic takes in China would be very different from what it has been in the first 3 years of this pandemic.
So will this swift spread of infection in China affect us in India? While the surge has remained confined to China so far, Amitabh says that it may travel across border and affect other countries.
We cannot be smug and say it's not going to impact us at all. In the past, we have seen any outbreak anywhere in the world has had impacts on other countries as well. What happens is international travel is now almost back to the levels that existed before the COVID pandemic began in 2019. So there is a lot of people moving from one country to the other. And this is how a virus travels. So anything happening in China is not completely secluded. So anything that happens in China, it would have implications for the rest of the world as well. So what every country, India included, would need to do is to at least reactivate the surveillance that existed when the pandemic was much more active in their countries. So in India, for example, the surveillance has gone down, the testing has gone down. We almost are in a position where we believe the pandemic is over, at least for us. But the way the virus has persisted and it hasn't completely disappeared, it has been reappearing after different periods in different countries. The fact is that it can come back at us as well. So no immediate danger in the sense that the surge in China is not going to immediately result in a surge in India as well. But we need to look out for the evolution of new mutants, for example. We need to reactivate our surveillance, probably start screening people who are coming from other countries. Those kind of things would have to be done if we want to continue to protect our populations as well.
And next, we talk about a unique football tournament in Jharkhand. Sports can be a great way to exercise or even bring people together. But can it be used to address a social problem? In Jharkhand's capital, Ranchi, hours after the much-celebrated Football World Cup final in Qatar, another football final brought delight and awareness to the largely tribal population on field and in the audience. Indian Express's Abhishek Angad joins us to talk about the Matra Shakti Football Tournament in Jharkhand, which was contested by 32 all-women teams from 23 villages, where around 480 mothers participated as players. So Abhishek, FIFA just ended and the whole world is still talking about it. I mean, the football fans are. But there was another less talked about football tournament held recently, which is the Matra Shakti Football Tournament in Jharkhand. Can you tell us about this tournament?
Yeah, sure. Everybody was watching the football, and of course, everybody spoke about how there was a great match between Argentina and France yesterday. But like hours before the final FIFA World Cup, there was also a final match which was ongoing between two teams in Jharkhand's capital, that is Ranchi. So this entire experiment has been done by one social enterprise which is known as Pratigya. And it started in 2017, and this year it is their fourth edition. So the concept is that one of the founders found out that there are very less adolescent girls who are occupying public spaces, especially the playgrounds. And then they realized that there are like multiple problems behind that. And instead of a solution, they found out that why not engage their mothers in the field and see how does that work. So continuing this practice this year, they had actually tried to rope in as many as mothers, and they found out that they were able to form with the help of course, mothers and villagers and their husbands, they're able to form 32 teams from 23 different villages in two districts of Jharkhand, that is Ranchi and Khunti.
So you just mentioned that the organizers noticed that adolescent girls were not really claiming or occupying public spaces, and that's why they wanted the mothers to come out and, let's say, lead by example. Was that the only driving idea behind organizing this tournament?
Yes, so the organizers had also in mind how to achieve multiple goals using football as a platform. They asked the working mothers to play, then they're actually cutting across the gender stereotypes in the villages and also giving some lessons to the men in their life. B, if the mother actually occupy a playground, then their children, especially girls, they will also occupy the playground and they will also be allowed to play. So they're empowering the mothers to play football. But the only mandatory thing that was done was that every team has to select one theme which is around the social ill of the time. So each and every team had to choose one theme and there was ideation behind it. So one team actually prepared, sat together, spoke to the village, spoke to the community members, and they came out with one theme. And organizers and as well as the team members believe that it's too early to quantify the change, but they are seeing some sparks in here and there, and how inculcating these themes in their football matches can actually have some positive impact in how they view things.
Okay, and Abhishek, can you give us a few examples of these themes of different teams during the tournament?
One can understand that there are a lot of issues that has come around in Jharkhand over the last few years, and domestic violence and substance abuse are the three ills that actually dominated most of the conversation around 32 teams. So, for instance, in one team that was in Kudlong village in Ranchi district, so one of the team members, when she had discussed the idea of playing football in the field nearby, and then one of the mothers, so her husband actually slapped her and he beat her up several times. He also stormed her the mud stove and did not allow her to go out. But the team member actually joined all together their hands, and then they spoke to the husband and said that, and they spoke about how the teams and the play and the themes are very important. So while they were selecting the members and while they were all forming teams, since one of the team members had already suffered with domestic violence, then they came together and they actually said about, okay, let's put our theme as domestic violence. Likewise, so the Chutta Sudha, that one of the team members which played the final and actually won the so-called World Cup of their village, won the tournament, and they had kept a theme around witchcraft. Because Khunti is an area where education has also not reached to the last mile, and there are a lot of superstitions involved regarding witchcraft. There are various women who are being marked as witches, and people actually believe that they are witches and they will do harm to the village and the community. So they had formed, seeing that there are a lot of issues all around, they had formed their theme as against witchcraft, and they applied their mind and also drew on a chart paper that why it's important to bring it in. They actually have their conversations around it, and they also think that maybe someday this will come to an end.
And as for the themes raised in the tournament, let's hear it directly from Lakshmi, who is one of the coordinators.
पहले जो रजिस्ट्रेशन फॉर्म था उसमें मुद्दा भी सेलेक्ट करना था कि आप लोग को जो लेना है आप ये कर लीजिए, तो उसमें से सब टीम का अलग अलग, किसी का हमको लगता है यहाँ अभी झारखंड का हम बता दे तो हम जैसे
बहुत ही अच्छा गोल करने का प्रयास, और जिसे
8 या 9 बाल विवाह और 11 टीम नशा पे, तो ये पूरा टक्कर में चल रही थी। पूरा झारखंड का हमको लगता है बाल विवाह और नशा पे पूरा एकदम त्रस्त है।
अच्छा।
So Abhishek, coming back to one of the things you just mentioned, which is a lack of education in some areas. Can you tell us a bit more about that, or about the areas where the tournament was held, so that we get to know about its, let's say, cultural or socio-economic background?
So all the 480 members that played the matches here all belong from tribal community. So most of the women who actually played were wives of farm laborers, farmers, and some men who actually worked as drivers or daily wage laborers and came to the city and worked. Of course, if you talk about how economic inequality, that's the place. And most of these women also are not very educated or had gone or completed graduation, their undergraduate degrees, or some are 10th pass or have just studied till 8th or still 12th. So this is the socially and the educational background of this. So these all belong from tribal communities in Jharkhand. And the tribal community specifically in Jharkhand has very low on health parameters. For example, most of the women and children are anemic. Many people are malnutrition because of lack of government's focus in many various schemes, as well as education. Now the government is actually looking into it, but even now there was a survey report released today, which included 16 districts, including Khuti, where there were a lot of problems and there were a lot of crisis in the upper primary and primary schools.
And Abhishek, I have to ask this. Why football? You know, in India, Kerala and West Bengal, they're widely considered as football capitals. But is this game as prevalent in Jharkhand as well?
As we all know, if you're talking about football as opposed to what, so there are a lot of reasons, right? There are logistic reasons. So if there's a hockey, then everybody had to be provided with a hockey stick. And there were a lot of chances of getting injured. So football was relatively cheap because, of course, this Pratigya who is holding everything. There was some sort of little bit of entry fee, but it couldn't cover the entire organizing of matches and giving them jerseys, those kind of costs. So football also, and third was training. Because this football, in my experience also, in many villages that I go and see, in every corner people are playing football. And the other day I was having a conversation with a man from tribal community in West Singhbhum district 15 days ago, and he said that it's just that the Jharkhand government doesn't promote or Jharkhand government doesn't advertise the need to play football, so the talent is not coming out, or else in every nook and corner, especially in village, people will actually watch football carrying an umbrella. I have seen that personally. In Ranchi, in the heart of Jharkhand's capital, there's a match ongoing in Ranchi University, and all onlookers and standby, they came and they just with their raincoats and with their umbrella to watch the football. And these kind of things actually show that in Jharkhand people are inclined towards football. So football was, I think, was a natural selection for a lot of the organizers due to logistic reason, as well as the popularity does it hold in rural areas. Also, the kind of relatively ease of being trained, or relatively ease of getting these women trained football, because many people play. So due to all these reasons, there were actually football was the game that was chosen.
Okay, and you met these players. So how would you describe their participation as a step forward in whatever issues they were fighting against? As you mentioned, some chose domestic violence and others as their themes. So how would this game impact that cause?
So basically what is happening is the change, as I told earlier, that it's not very easy to quantify it now, but what women told me was that when they were talking about it, they made sure that their son or their daughters are actually hearing everything. So they are also aware of their rights, and they also ask their sons, especially men, not to indulge in domestic violence or sexual harassment or drinking abuse. So the immediate effect is like one of the women, that is Mrs. Kachap, was saying that in her locality there was a place where there were a lot of eve teasing, the word that she used. So she's saying in the last 1 and 2 months, there has been a drastic reduction in those instances, or there is a drastic reduction in reporting of those cases. It's too early to say whether or not this resulted in reduction of the instances of sexual harassment, but she attributes it to the fact that a lot of deliberation and discussions were going on in the village, within the community, inside houses, which may have had an impact on all these things. There's another instance of how when girls come to play to the football match, so the organizers and the women say slowly is their daughter only who are actually encouraging them to go and play. So when this is happening, now they're sure that this in a gap in around 10 years of time, they'll be able to see some drastic change that has happened within this community.
And in the end, we give an update on the case of the infamous French serial killer, Charles Sobhraj. The Supreme Court of Nepal on Wednesday ordered the release of Charles Sobhraj, the part Indian conman and serial killer, on the grounds of his age. Sobhraj who is in his late 70s, has been lodged in a jail in Nepal since 2003 on the charges of murdering 2 American tourists. He has also served time in India for poisoning French tourists. The 78-year-old had petitioned for early release on health grounds, and the French embassy had approached the Nepal government for this. Now, with the release order, the court has also ordered his deportation within 15 days of his release. Sobhraj was born in the then French-occupied Saigon, the son of an Indian businessman and a Vietnamese shop assistant. Sobhraj later moved to France after his mother married a French soldier. He took to petty crimes early, moving in and out of jails since his teenage. In his long criminal career, Sobhraj has been dubbed the Bikini Killer because some of his victims were found in bikinis, and also as the Serpent for his skill at slipping away from law enforcement authorities. He has been allegedly involved in the murders of backpackers, most of whom were Western tourists in Asia. His modus operandi included drugging his victims and then killing them. He was most active between 1972 and 1976. It is estimated that he may have had as many as 15 to 20 victims in the 70s. He has also served time in India for 21 years, which included a 22-day break period when he escaped Delhi's Tihar jail in 1986. Back then, he had drugged prison guards with the excuse of sharing sweets for his birthday. You were listening to The Three Things by the Indian Express. Today's show was hosted by me, Anwiti Singh, and written and produced by Utsa Sarmin with my help. It was edited and mixed by Suresh Pawar. If you like the show, then do subscribe to us wherever you get your podcasts. You can also recommend the show to someone who you think will like it. Share it with a friend or someone in your family. It's the best way for people to get to know about us. You can also tweet us at Express Podcast or write to us at podcast@indianexpress.com.